Kendra. Kendra Jason is an assistant professor in the Department of Sociology at the University of North Carolina, Charlotte. She's an interdisciplinary health disparities scholar who examines individual level factors, contextual factors like the workplace, and life events that may influence the relationship between health and desired workforce participation in older African-American workers. She is currently on the steering committee for the Sloan Research Network on Aging and Work. Welcome, Kendra.
Thank you, Tina, and thank you for the invitation, all of the collective minds that came together to invite me to speak on older Black workers, low-wage workers in the context of COVID. Next slide, please. So I wanted to just briefly start by introducing you to my work as far as intersectionality. I look at older, Black, low-wage, full-time workers with chronic illness. And what I really want to understand is how the health and work challenges of this population can be supported by the workplace environment. So how can the workplace help or hinder them from moving forward? I also talk to these workers to see what strategies they have employed to remain engaged in work as long as they choose. And then I would like, of course, to be that bridge of communication between workers and management and organizations, forming interventions and offering recommendations so that older workers with these different intersections can work as long as they choose. I do have my website available here if you would like to look more specifically at my research in detail. Next slide, please. I am hugely passionate and driven by the simple fact that Black workers disproportionately face challenges in labor market compensation and retirement benefits. Next slide, please. As Tina described, there is an ongoing and slightly new conversation about working longer and what that means for the American workforce. Americans are able to work longer due to advances in technology, medicine, and other means. And Black workers in particular are working longer for financial support and health insurance. And this relationship is even further compounded when that individual is a low-wage worker and does not even have a conception of retirement, that has no plan for retirement because they cannot afford to retire. Next slide, please. So where does this come from? And I'm thankful that Tina laid out that intersectional introduction for you so that you can understand these earning differences do embody a life course perspective. And so what you can see here from 1979 to 2020, African-American adults are represented by that Black squiggly line. Unfortunately, that's at the bottom of many graphs about social benchmarks. And Black workers over time have earned less income than all other workers. Next slide, please. And this gap does continue to grow. So again, from 1979 to 2015, you can see how the gap is actually growing wider instead of getting smaller when it comes to income between Black and white workers in particular. Next slide, please. So if you think about it, yes, where does this come from, right? If you think about it, your Social Security, your 401k, and if your job offers pensions, is directly tied to your individual employment history and wages. And so because of racial discrimination over the life course, because of economic oppression that Black workers have faced, Black workers earn less income over the life course. Not only do they have less income, but they're less likely to have insurance support in comparison to their white counterparts. Another key factor for Black workers is unionization, because unions give access to denied benefit plans. And so since unionization has decreased so drastically in the United States, that leaves Black workers, again, on the negative consequences of having less access to fair benefits. Next slide, please. So discrimination plays a role. So research has found that those who face regular discrimination are disproportionately burdened by multiple chronic conditions and thus face greater challenges when they want to continue work. And research has also found that even the perception of discrimination produces stress that increases these negative effects related to having health conditions, health risks, and the ability to function later in life. Next slide, please. So when we look specifically at Black and white Black and white adults in later life, Black adults suffer more chronic illnesses, have poorer health outcomes, and higher death rates compared to nearly all other racial groups. They report higher rates of diabetes, hypertension, asthma, arthritis, obesity in comparison to whites. And even when you consider mental health, older Black adults, experience higher rates of depression than older white adults. Next slide, please. So COVID-19 has exacerbated these issues when it comes to racial injustice and the outcome of employment precarity. Next slide, please. So if you look at this graph here, you'll see that from February to May of this year, those ages 25 to 54 had a 11% loss in employment, okay? Of course, this is due to the effects of COVID-19. For ages 55 to 64, a loss of 10%. But then those 65 and older, a loss of nearly 17%. So if you look at this in comparison, for those ages 55 plus, they've lost or had a over 25% loss, which is over double that of those ages 25 to 54. The thing that makes COVID so devastating for older workers is that it's related to health risk. And as those health risks increase, so does the unemployment rates. Next slide, please. So the CDC back in July released a report that said people from racial and ethnic minority groups are disproportionately represented in essential work settings. We all know this. This is not news to us anymore. But to really think about those people having a greater chance to be exposed to the virus because of their close contact with the public, because they're not able to work from home, and because they do not have paid sick days. Next. So the media has released some reports about older Black workers. Click slide, please. Click the slide, please. Thank you. Among older workers, Blacks and women face higher COVID-19 risks. Those over 55 remain victims of employment crisis. Can you click the slide again? And then just thinking about race and age in general, health workers, especially minorities, at high risk for COVID, even with personal protection equipment. Workers facing racism and economic inequality, and then Black essential workers twice as likely to experience retaliation during a pandemic. Next slide, please. So fortunately, there have been some really good research by some scholars of color, especially Black researchers who've been dealing with health disparity research and have quickly connected the effects of COVID. These are just a few of the research that's been reported in the journals of gerontology, health education and behavior, the New England Journal of Medicine, the Journal of American Medical Association. They all generally give you statistics, but really talk about structural racism and how the pandemic disproportionately negatively impacts older Black people, especially, but ethnic and racial minorities. Next slide, please. So I want to end with some workplace recommendations for COVID and beyond. One thing is that workplaces really need to be thoughtful and think of creative and innovative ways to better support older workers. Go beyond flexible work arrangements. Think of more nuanced ways to stage retirement. Have policies, equipment, practices in my ergonomic practices in mind. We need better adherence to the American Disability Act. We need more social support programs that seek to understand how racism, sexism, ableism operate locally within your workplaces and then address those things. We need stronger enforcement on race, gender, and age discrimination. And we also need workplaces to work with legislature to create policies to ensure economic security and safety through Social Security, retirement, and public assistance. Mary Gaeta has spoken a lot on this about older workers and policy. You can see her research as well. Next slide. And I just want to end with some research recommendations, really center the experiences of Black workers. There's a saying that when America has a cold, Black Americans have the flu. The employment sector is another place where you can find this. Older Black women are another place for you to focus your research. Older Black women are caregivers, work in low wage work, service work, but they're also in professional jobs and are very socially mobile. So they're a great resource to figure out strategy and maintenance and resilience. Think about the workplace as a point of analysis. And then fund community-based research designs. Again, those researchers who are already reporting on COVID and its disparate effects have been doing this research and have been struggling with funding. And now their voices are amplified. So please support and fund Black health disparities researchers who can really give us some insight since they've been doing this work for a number of years. I thank you for your time and I'll answer questions later.